Right. Who do we have here? Patient 603. Well, pleasure to meet you. I'm Dr. Murmurs. Why don't you begin by telling me what's happened to you today? You what? Jesus, Mary, Joseph, and the wee donkey. That is some story, I tell you. Some story. Well, you'll be feeling a little bit tired, I imagine. Not to worry at all, you're in the right place. So here is the cranial nerve examination clinic where we look at all types of head injuries and we assess and make sure that, your cranial nerves are working well. And after the day you've had, you'll need a thorough examination. And of course, I'm always known as the doctor that is always over-explaining things. So you're in great hands, and I'll make sure that you understand exactly what's going on at all times. Alright? Okay. Let me just check that I've covered everything. I've been reviewing your notes from accident and emergency today, but they never told me that's what happened to you. My goodness. Right, so I'll just briefly explain to you what's been happening with this. So how the cranial nerve examination works is we're going to do a series of different tests to look at 12 different cranial nerves, okay? So there is probably about 20 different tests that we're going to run on you. Now they're very relaxing, you just need to keep calm and carry on, as I say. You'll be fine. You'll be fine. And if there is any issues, you're in the best place and we'll make sure that you're fixed up. So some of these exams may be a little bit intrusive, not too much so, but a little bit of touching of the face. We may need to put some drops in your eyes as well, just to have a look into the back of your eyes. We need to dilate your pupils. We have a couple of little tests where we use a little pinprick, for example, or a little soft touch. And we also have a hearing test and things as well. So there's plenty of tests here for you today. Does that all sound about right to you? I see you've had a cranial nerve examination before. So you're prone to injuries of the head. Prone. Are you always doing daft things like you've done today? I see. Okay, prone to injuries. Just useful for me to know for my medical notes. Okay, moving on. I just need to check your details with you. I've got some details through from accident and emergency, but can you please confirm your full name? That's fine. And can you confirm your date of birth? Alright. And your post or zip code of your address? And the first line of your address. I just need to run through a couple of medical histories with you. Have you ever had any blood disorders, either you or immediate family? So it could be blood clots. No. How about any heart disorders? So that could be a heart attack in your family or any known congenital heart abnormalities that either you or a relative has had. Okay. Are you a smoker? Would you say that your alcohol consumption is above moderate? Alright. Have you ever suffered with a stroke? Epilepsy? Ever had any fitting for no explained reason? Alright. Have you ever randomly become drowsy and there's been no explanation for it? Okay, and would you describe your vision as normal? Okay. You don't have any hearing or seeing difficulties, do you? Okay, that's fine. And your general feeling just now, are you feeling sick or dizzy at all? Okay. Well, that makes you a great patient to start with. Sometimes we see patients that are pretty poorly, so that's at least something for us. Now, the next part of this cranial nerve examination is for me to wash my hands, but I've already washed my hands. Will you take my word for it that I've already washed my hands? That's fine. Take word. We will be using gloves, to be fair, at some stages of the examination, but not straight away. Right, well, we better get to it, shan't we? Now, we're going to start with cranial nerve number 1. Cranial nerve number 1 is the olfactory nerve. Have you ever heard of that before? It's the nerve that's responsible for your sense of smell. So we are best placed to check your sense of smell, and that'll tell us whether there's anything at all that's wrong or an issue we need to address with that olfactory nerve, cranial number 1. Okay, so I have selected a total of 5 aromatherapy oils that I think that you may or should know what it smells like. Now, if you can't guess the exact scent, that's not a problem at all. If you can describe what you're smelling, then that is enough for me. Okay, so we'll begin with the first one. I'm going to begin with this one here now. Just let me know what exactly you can smell. I'm just going to hide the name of this from you so that you can't cheat. I'm going to wave it across your nose like so. And probably from about there so it's not too overpowering, because sometimes when it's a little bit too overpowering, you'll end up not smelling the actual scent that you just smell. So, right, we're just going to come up nice and close. Here we are. And we're just going to... That's it. Very good. Excellent. Can you tell me what that was? Great. It was indeed, you could smell lemon. Now, it was specifically lemongrass, but you couldn't have possibly known that. So it is lemon, so that is absolutely bang on. Dead on. We're dead on. Right, next we've got... Now, I would expect you to get this one as well, so let's have a quick... Just to make sure that it's nice and strong. There we are. So I'm just going to hold it here and just do this like so. Just backwards and forwards, backwards and forwards. It is indeed. You're dead on again. It's, of course, it's lavender. So lavender is exactly what that is. Well done. So far you've got 2 out of 2. It's me just drawing on my wall there. The cleaner won't be so happy with me. Right. Our next one is a little bit harder because it's a very different scent. But if you can kind of explain what it is, if you don't know what it is, but you can explain what you're smelling, then that's perfect for me. So let me just make sure. There it is. Okay. So I'm just going to wave it back and forward to make sure that you get that as we did with the other ones. Can you smell that okay? Okay, yeah, no, that is right. It is herby. You would use it in cooking. Can you think what you would use it on? I'll give you that. So it was rosemary. I knew you would know it as soon as I told you. but I'll give you that one as well because you were able to explain exactly what you were smelling. Right, we've got the next one here. Again, this is a different smell. They're all different smells just to make sure that we get all of your scent buds there. Okay, so this one's a little bit stronger, so I'm going to hold it out here for you. We're just going to go back and forward, like so. Okay, you tell me what that is? It is indeed, it's tea tree oil. I knew that if you use any spot treatment, you'll get that straight away. It's a good one. Right, and our final scent taste that we're going to do today is this one here. And again, I'm just going to make sure I get a... Yep, there we are. Waft of that. So we're just going to come a little bit closer because it's a little bit weaker, this one. Look at that. Yes, you're absolutely bang on again, stayed on. So that is orange. It was very sweet, so it's actually a sweet orange, just to really get the sweetness working in your scent. Great, well, that was fantastic. You scored 5 out of 5, so I have absolutely no problems there at all, or concerns there with your olfactory nerve, your cranial nerve examination, number 1. So we'll just tick that off, so that's very good. Okay. Now our next cranial nerve we're going to look at is cranial nerve number 2, and this is your optic nerve. So it is responsible for the majority of your sight. So we're going to start with your visual acuity. This is the Snellen chart. So I'm going to present this to you here. We'll sit this further back like so. Let's just check, approximately 1 meter. Okay, so can you please read the top line for me? Okay, and the next line. And the next line. Sorry, I'll move my fingers. And the next line. Very good. And the next line. All right, and the next line. And the next line. Can you get anything at all on the bottom line there? Great. So that was absolutely fine. Now normally that chart you would, if you were doing a full-on Snellen chart examination, you'd be looking to test at 6 meters, 20 feet exactly. But we're just looking at it 1 meter because we're not actually assessing your full eyesight. We're just making sure that you can see all the way to the bottom at, 1 meter out. That can tell us about your optic nerve. Okay, so that was great, well done. Now I'm going to do some visual field testing with you. So what I would like you to do is, if I bring it in, I've got my hands here, so I'm going to bring it in, and when I wiggle my fingers, and you can see my fingers wiggling in your peripheral vision, I'd like you to just nod. Okay, I'm going to test that for you now. So right. fields. No issues there with range of visual fields test. Alright. Now I just need to get some drops for you. Right. Now I'm just going to pop a couple of drops in your eyes, okay? I just need to dilate your pupils, okay? So just look at me. 1, 2. And it should get to work almost immediately, so while we wait for that, why don't you tell me about yourself? Maybe something interesting. Let me guess. Are you an avid horse rider? Let me guess what your favorite hobby is. You like to secretly knit little hats to put on the post boxes. No, it's not you. Damn it. Okay. You like to ride a bicycle. You like to play table tennis. Oh, I think that's your eyes dilated. Right, okay. Let's do your fundoscopy examination. So all I'm going to do here is look into the back of your eyes. Now, I do need a little magnifying glass. So, normally with your fundoscopy, I would use a machine. All of the clever ophthalmologists have a little machine, but not me. Instead, I'm going to use a light source and a small magnifying glass. And what I do is I look at the back of your eye just to make sure that that membrane at the back of your eye doesn't show any signs of wasting or decoloration, okay? I know this is a lot of information for you, but I like to keep my patients fully understanding of what's going on at all times. Okay. Set this down. Bring that in there. Okay, great. That looks absolutely fine to me. Now it'll take about 10 minutes or so for that to wear off, but it just makes you a little bit light sensitive. You should still be able to see, so we can carry on with this examination. So we've got now the assessments for cranial nerves number 3, 4 and 6. These are the oculomotor, the trochlear and the abducens nerves. Now what we're going to do is we're going to do the pupillary light reflex. So I'm going to shine a light in your eye and I need you to follow my finger in and out. Can you do that for me? Great, okay. So just follow it in and out. And in and out. And then, and I'll do the other hand now. So let's do the other eye in and out, in and out, in and out. Very good. That's all fine. Now you please follow my finger to different sides? Yes, so I'm going to shine the light again just so I can watch your eye. And I might put my hand out this way, we might go this way. I just need you to watch and follow my finger, okay? Great. So. I'm doing the other one. Very good. That's no problem at all. So that's the pupillary accommodation and also the pupillary light reflex, which is done. Now I just need to have a quick look because I need to look for a couple of certain conditions. So we're going to look for nystagmus, which is basically when your eyes shake. And the other one that we're going to look for is ptosis, which is the drooping of the eyelids. Now, from visual inspection here, I can't see anything to be of concern, but we're gonna have a little look anyway, okay? Right. Okay, it's all looking good to me. No, I don't see any evidence at all of nystagmus or ptosis, so that is fine. I need to just also check your ocular movements, so can you just look down for me? Okay, and look up. And look to your right. And to your left. Look down. Look up. To your right. Left. That's fine. Ocular movements generally consistent with normality, so that's all great. Alright, I think we can move on here to cranial nerve number 5, and this is the trigeminal nerve. Now, we're looking really at the sensation mainly for this nerve. There's two branches, there's sensor and there's also motor branches. We do have a couple of motor branches that we're going to look at, but more importantly with this cranial nerve, we're going to look at the sensory branches. So the first one we're going to do is all to do with soft touch, and then I'm going to do a pinprick. Don't worry, it's not going to be too sore. So we'll start with the soft touch. So how this is going to work is I'm just going to gently touch different areas of your face, and you just need to let me know that you can feel it, and just nod like last time now. Okay, so very good. That was responsive for all cottonwool touches. So now for the fun bit for me, not so fun for you. That is the pin prick. Right, so if I move this out like that, okay, now I'm just going to start. Okay. Good. Very good. You successfully identified all of the pricks. I see it wasn't as nerve-wracking as you thought it was going to be. Of course, we wouldn't hurt you. So it's all good. Right. So that's fine. Now I just need to quickly check the muscles of mastication. So just open your mouth. That's it. And just calm down for me. Just gonna feel while it's clamped down. Yeah, it's all engaged. There's nothing limp there at all. Great. That's all fine. Now we're going to move on to cranial nerve number 7, which is the facial nerve. Now we need to just assess you for facial symmetry. So I'm just going to, I've been looking at you all day and I think you've got a perfectly symmetrical face is what I tried to say there. That's all fine. And I also need to assess the muscles for facial expression. So just give me your best smile. Great. And give me your surprised look. And now your angry look. How about your sad look? And your funny look. And just do a crazy face. Great, well done. That's good. We're going to move on to cranial nerve number 8, which is the vestibulocochlear nerve, and that's responsible for your hearing. So we've got a couple of different hearing tests we're going to do. So the first one is my favorite. I'm going to use the gloves. And how this works is I'm going to whisper a word in your ear, and in the other ear I'm going to distract by using the gloves. And you just need to tell me, repeat after me, what word I have said. Okay. This is always a lot of fun. Right. Okay. Tomatoes. Smoke. Jokes. Candles. Bells. Harry Potter. Romance. Chips and cheese. Curry. Lights. Tofu. Northern Irish. Burning pasta. Lockdown. Pizza Hut. Soybeans. Mummy. Laptop. I think we're finished here, but I'll just keep doing this anyway. Very good. Very good. So, the second hearing test that we're going to do is this tuning fork. So I'm just going to hit it. And I just want you to let me know that you can hear it, okay? And tell me when you stop hearing it, alright? Okay. That's fine. Now for cranial nerves number 9 and 10, we're going to look at your glossopharyngeal and your vagus nerves. So can I ask you just to cough for me? Great. Can you just open your mouth for me? I'm just going to have a quick look inside. Nice and wide. That's it. Just looking at the back of your palate. In particular, I'm going to be looking at right here at your posterior pharyngeal wall. There. Okay. all looks great to me. And then we're going to look at your cranial nerve number 11, which is your accessory nerve. We're looking at your sternocleidomastoid muscle, so like what you did earlier. Can you bite down? And I'm going to try and pry your mouth open and just resist against me. Good. Now can you blow your mouth out? Like so, and just resist against me. Can you please make a turn to your left and just resist against me? I'm just gonna push. Alright, and then turn your head to your right. Same thing, just resist against me. Great, so it's absolutely fine. Now we've got one last nerve to have a quick look at, and that's your cranial nerve 12. So that's your hypoglossal nerve. We're going to look at your tongue. I know, a bit crazy, so I just need you to stick your tongue out nice and wide for me. That's it. Can you move your tongue side to side? Great, keep it sticking out. There's no wasting there, so that's absolutely fine. Well, my dear, you'll be pleased to know that I've not detected any sort of issues with your cranial nerves. In fact, they're in perfect order, which is interesting considering you've had that many cranial nerve examinations and head injuries. You have some tough skull there, my friend. So if anything changes, if you get any sort of dizziness or any visual hearing loss, any facial muscle issues such as drooping of the mouth, or just that you feel that you can't chew properly or turn your head, please come back in and see us. But from what I've seen here today, everything looks fine, so I'm happy to send you home. Make sure to get something nice to eat along the way home if you've not had anything to eat all day. And well, with your track record, I'm sure we'll see you again here sometime soon. Bye for now. Take